Hello everyone. Today I'm going to discuss ECG with you. Whenever we take ECG strips, what we see? First thing, we see this kind of squares. This one, two, three, four, 1, 2, 3, 4, 5, 1, 2, 3, 4, 3, 4, 5. Okay. Here we will see the seconds time and here we see the amplitude. Whenever we take the ECG, we must appreciate this small square and the large square. If we can appreciate the squares, ECG becomes more easier for us. The time duration, we must remember the time duration. If we do not know the time duration, we cannot say the tracing in the ECG are normal or abnormal. The duration of this is 1 mm, amplitude zero point 0.4, overall 0.8, 0.12, 0.16, 0.2. We must appreciate this large square. This is one large square and these are small 5 large square. To make it more simpler, I am writing here this is 0.04 second is one small square, 0.2 second is this 5 is 5 small squares, 1 second is 25 small square or 5 large squares. Why we are taking 25? Because the ECG tracings is the paper moves, ECG paper moves at 25 millimeter per second and there is a standardization of ECG. This is of 10 mm. Whenever we see the ECG paper, we must know or we must see the written standardization of 10 mm in amplitude and 25 millimeter per second speed. If you do not see these findings, these written in somewhere on the ECG paper, then you can ask again the tracing is not normal. Why this is require the standardization of the ECG? Because if you see if there is a hypertrophy in some patients and there is unusual large QRS complexes, this P Q R S T. If you do not do standardization, then we cannot say this is normal or abnormal ECG. So we must do this, we must ask for the standardization for the ECG. The standardization, basic standardization is 10 mm and speed is 25. In some conditions, the cardiologist can ask for the 50 mm speed. If you observe, they can ask for the 50 mm speed or double the standardization of size. Maybe they can ask for the 20 mm. The condition where ECG complex are very small, it is advisable to double the standardization to study Q wave. In other way, we can ask the cardiologist can ask to reduce the standardization from 20. This normal is 10 mm. He can ask for the 5 mm standardization. The time duration will also reduces. Why that 5 mm? The condition like there is a hypertrophy or large QRS waves. There are the two example where the cardiologist can ask for the reduce or double the standardization. So whenever you hold the ECG paper, first of all, first thing first, appreciate the squares, small square, large square. Another thing is look for the standardization. The standardization is 10 mm or 25 mm per second speed. If you are comfortable with this, then we will move towards. After taking these two things, another thing is first go for the AVR lead, because all the waves to be inverted in lead AVR unless the limb leads are wrongly placed or patient having dextrocardia. Okay, AVR. We must remember this AVR lead, everything will be negative. So after taking the ECG paper, first thing, appreciate the squares, appreciate the square and duration. Second thing, you have to do the check for the standardization, the size of 10 mm amplitude and 25 mm per second speed. Number 3, go for AVR lead. AVR lead must be negative. Everything, all all the waves to be inverted in lead AVR2. After going for the three things, you are happy that okay, squares duration you have checked, standardization you have checked, and AVR lead is negative. Okay, you are happy to go for the others. Now coming towards the P waves, I will discuss a very small values so you will be comfortable. P wave, you know P wave, I will not going to that diagram. Just remember P wave, the P wave, the duration must be less than 2.5 mm, the amplitude and less than 0.12 second, that is 3 small squares. Whenever you see the P wave, appreciate the P wave, that it must not be more than 3 small squares. This is the P wave, it must less than the 0.12 second. If you say the more than 0.12 second, then there may be some abnormality. If height is more than 2.5 second, then there may be some abnormalities. So I'm discussing here about the normal, so please note it down, the P wave abnormality. If this is normal is less than 2.5 mm, amplitude means height, and this is duration. Now coming towards the another point, PR interval. PR interval, what is PR interval? That is, it is a beginning of P wave. Please note it down, beginning of P wave to QRS complex. Okay, what I'm discussing is the normal values. If we know these basic things, then we can appreciate, or we can exactly say this is normal or abnormal ECG tracing. If you find out P wave size is less than 2.5 mm, or the horizontally is less than 3 small square, it's good and fine. We can add one more point is we can appreciate lead in a lead second. We can much more better appreciate the P wave. Now another is PR interval duration. What is PR interval? It's a beginning of P wave to QRS complexes. It may be variable. PR interval is variable in different leads. Different leads, it's variable. But shortest interval should be noted. Should be noted. What does it denotes? The PR interval denotes the time taken, for stimulus to spread through atria and pass through AV junction. Its normal duration of PR interval is 0.1 to 2.2 second. Duration we must, in beginning also I say you must remember the duration, so it's 3 to 5 small squares. Okay, if there is a conduction more than 0.2 second, then maybe heart blocks. But I will not go towards the disease related to the abnormality. If we know the initial beginnings, the normal range, we are happy in that also, that this is normal or abnormal. After PR interval, we will go towards the third, QRS complex. QRS complex is most confusing because there are many values and many various forms. Sometimes Q waves present, you can say sometimes R wave present or R wave absent. is the most confusing. What is Q wave? It is initial. Q wave is initial negative deflection. Negative deflection. R wave is first positive deflection. S wave is negative deflection followed by following R wave. Okay, if you found R dash, then we can say R prime. This is positive. Another positive wave after R wave. Another positive wave after R wave, or S dash, or is another negative wave after S. Okay, so QRS complex little bit confusing, but we need to know what is Q, R and S, R dash or RS prime. There are many forms of the deflections we will encounter. So first we are taking over the normal things. So the normal duration of QR is 0.1 second to to 1 point, sorry, to 0.12 second. So we can say is less than 3 small square. Understood? Less than 3 small. If the QRS, this initial negative deflection, then positive, and this S negative, is the duration, it must be less than 3 small square. If there is more than 3, then there will be chances of hypertrophy. Now coming towards the fourth point, ST segment. What is ST segment? It's end of QRS to the beginning of T wave. Beginning of T wave. And it is also the beginning of ventricular repolarization. Is generally ST segment is isoelectric. Is isoelectric means it's a flat line on the ECG paper. It's neither positive nor negative. ST segment is baseline. Sometimes sometimes there is a little bit deflection in the ECG of less than 1 mm may be appreciated, but it should be less than 1 mm. If there is a more than 1 mm deflection in the ST segment, there is chances of abnormality. The most common we see ST segment elevation in MI. So we need to know the normal values. The less than 1, it's not is a ST segment is a isoelectric line. And now coming towards the fifth, that is T wave. T wave, what is T wave? It's ventricular repolarization is less than 5 mm in limb leads and less than 10 mm in chest lead. So again, now we know that if there is a positive or negative, T wave can positive, can be negative, but it cannot be more than 5 mm or 10 mm. Okay, so we need to know this again normal values. Another going towards the sixth is QT interval. QT interval is beginning of QRS to the end of T wave. It represents the return of stimulated. What does QT interval represent? It represents the return of stimulated ventricles to their resting stage. The normal duration of is 9 to 11 small square. Okay, so we have discussed this normal durations of many things. And sometimes you appreciate U wave also. What is U wave? Is a small rounded deflection seen after T wave. It most prominent in hypokalemia. So if you know this much about the ECG, this is the basics of ECG. I'm not taking up on in the coming furthermore lectures. I will discussing about the more segments, limb leads, chest leads. But if you know this much basics, then our life becomes very easy in the reading. In nutshell, if you want me to write in nutshell, then P wave is less than 2.5 mm, amplitude less than 3 small square in horizontal, yeah, 0.12 second. Then Q wave, I have not discussed about the Q wave. Is septal, it is a septal is a deviation is less than 1 small square. If it's more than 1 small square, then the Q wave, if it's more than 1 small square, it's a pathological Q wave. Pathological Q wave. Now PR interval is 0.1 to 2.2 second. QRS is less than 3 small squares. The ST segment less than 1 mm deflection. T wave less than 5 mm limb leads or less than 10 mm chest leads. QT interval is 9 to small squares. So this is the P, Q, R, S, T, R, S, T. Whenever you get the ECG paper, just look for the normal values of ECG and R waves, T waves. Standardization, the amplitudes of this. If everything goes normal, then the ECG is normal ECG. If there is a derange in these values, then that is abnormal ECG. Furthermore, I will discuss in another video. Thank you for watching.